opportunity. My name is Dr. Ralph. I'm a consultant surgeon, the director of the Greater Accra Regional Hospital, and the president of the Kofi Global Alumni Ghana chapter. And this is one of our activities. About a week ago, we did a medical screening at the Zonal Council office. We saw about 537 patients, and out of them, a few were selected to do surgeries. The surgeries are split into two. Those that have eye conditions for which they are being operated on in the other theater, and the rest of our surgeons are here also operating on those who are going to be here. Unfortunately, the numbers are so huge, so it's been split over a 2-day period. So we're doing half of the cases today, and then we're doing the other half tomorrow. And since we started in the morning around 9:15, a couple of them have been seen to and are gone. So this is what we are doing as our give back to the society. It's a broad range of health issues that we saw at the medical screening, but those that we are seeing now are those who need surgical intervention, who either can't afford or a surgeon is not available to do this thing for them. So there's a sort of outreach we are doing to the people in the Amasaman area. The feedback has been good because everything that is being offered here is technically free, because the medical superintendent of this facility has given us theater space to work with. Even though we came with logistics, they've also supported us both with human resource, they are skilled health workers here, and also with some pharmaceutical drugs and other things that we are using. So basically, we've had support from the hospital as well, even though we also brought in some things to work with, including equipment. A combination of specialists and consultant surgeons, nurses, not only from the Greater Accra Regional Hospital. There are some that have come from Konfanochi Teaching Hospital and elsewhere. We belong to an association, and it's these alumni that have come here to do the work. It shows the complexity and the myriad of problems that Ghanaians have, and so we hope that maybe we'll be able to come back and do this again, because I realize that we can't do all. The number of patients and the volume we've seen, even though our intention was to do it over one day, now we had to change the strategy to 2 days and even work over this weekend. So basically that is what it is. But overall, I think we have to develop a medium to long-term plan where we'll have these surgical outreaches in this peri-urban and marginalized places in terms of healthcare, where the skill sets for surgeons are not there. We do these outreaches to try and reduce the disease burden. My general advice is, if anything grows abnormal within your body, you have a swelling, you have pain, you have anything you feel abnormal, please go to hospital. Even if that sort of specialty care is unavailable, the doctors will refer you to a center where care can be given. So that's my advice. You feel an abnormal swelling or a lump somewhere, you have a pain, you have a discomfort, please go to hospital first. Be seen, and even if that sort of specialty care is unavailable within that locality or geographical location, you'll be sent to a place where care is available. So that's my advice to the general public. The medical superintendent of this facility has agreed to let his clinicians do the aftercare for us. Most of the cases that we've done, the aftercare is technically not difficult, so they have agreed to take over. But in the event that there's anything else that is beyond them, they are likely to refer to the Greater Accra Regional Hospital, formerly called the Greater Accra Regional Hospital.
We are here today to join other teams in doing a clinical outreach where we offer free surgical services to those who would otherwise not be able to pay for their services. I'm part of the eye team, the eye care team. We were here last week to screen and to pick up, few cases that needed surgery. So today we are here to offer the surgeries to the people. We've already done most of the cases already, and we have a few left. These are cases of cataract, which is the commonest cause of blindness. Everybody gets cataract. Everybody eventually will get cataract. So it's not like somebody has cataract, I don't, and therefore I don't care. And unfortunately, most of the people will not be able to afford their surgeries. Right here in Accra, we have picked up a number of those who are bilaterally blind in both eyes, blind from cataract. And all cataract needs is to be taken out. So a 20 minutes, 30 minutes surgery, and the person can see again, to go about their business, to be able to offer, care for their family instead of depending on others for everything. So this is an essential services, that we offer, and it's not just Kolebu that offers it. Today we are here because of the Kofi Global Alumni, which is a group of people that have been trained through the Korean government. So they also train a number of people, biomedical engineers, administrators, clinical experts. So I was part of the team that went and trained, and we are here. The eye care team, everybody in the team is offering their services, not just because they're trained in Korea, but because there's a team that cares for eyes, to make sure that people don't go needlessly blind. The commonest thing is aging. If you are 40, you realize that you get to 40 and you are unable to read things that are either too small or they are too close, and then you have to keep taking it back to be able to see clearer. And that's the beginnings of cataract, when the lens in the eye starts changing because of aging. Then you are unable to read close, then you need glasses to read. Now it keeps progressing until eventually you are unable to read at all, you can't see at all. Then that's the end stage cataract, then we have to take it out. So yes, a cataract is the commonest cause of blindness, and luckily enough it's reversible, meaning that once we do the surgery you should be able to see again. Unfortunately, the other causes of blindness, one being glaucoma. Glaucoma causes irreversible blindness. There's nothing we can do about it. So we need to prevent the blindness from glaucoma as well. And that's one of the reasons why we go out to screen, because glaucoma will not give you pain. It will not blur your vision, and the next minute you are blind. So when we screen, we pick up cases of glaucoma and start treating so that they don't get to the stage of blindness. The other causes of blindness or even cataract, diabetes is another common cause of blindness. So if you have diabetes, or you've been told that your blood sugar is high, you need to control it, because once diabetes also blinds the eye, it's also irreversible and we can't do anything about the eye. So all diabetics are supposed to have their eyes checked, maximum every year. And if we pick up something, if the diabetic retinopathy has started, then it means that even the 1 year is too long for you. Every few months you have to be in the eye clinic for an eye care person to look at your eyes. And if there's any management that we start, and we start as soon as possible. It is annual. Now, when it comes to Kolebu or any other of the other hospitals that offer outreach services, it's throughout the year. But this particular one, which is from the Kofi Global Alumni, it's annual. So we have gone to Pram Ada. We've gone, that was last year. Then the year before we were in Sawam. So yes, every year. And next year we'll find another place to go. Blindness, can creep up on anybody. And you need to take a conscious effort to have your eyes examined, because like I said, glaucoma is not painful, very painless, and it takes away your vision. So make sure that you, at least once a year, you see an eye care person to examine you, to make sure that everything is okay.
My name is Evans Kosi Kudufia. I'm coming from Hobo, near Ashalaja. Yeah, I came to Amasaman yesterday for treatment, and when I came and I heard that they will be doing a free eye treatment today, I've been having this problem for the past 6-7 years. The first one, I did the operation at Emmanuel Eye Clinic around Tetekwasi roundabout. That one I was helped by a friend doctor, so he paid for me. And this time the second one has grown up, and I've been thinking how I'm going to raise money to do it. So yesterday when I came for a checkup and I was told that there will be a free eye treatment today, I was so happy. So I decided to take this opportunity to get mine done for me. I'm taking this opportunity to thank the doctors who have organized this thing. I thank them so much. God bless them. And I also came with my friend Thomas Goku, but just unfortunately his cannot be done because he has a very high sugar level, and I'm so sorry for that. But anyway, I pray that next time you get another opportunity. I'm very, very happy, and I'm thanking all the staff members of Amasaman Hospital. I'm thanking them all for giving me this opportunity, especially Dr. Dinah and Vida. They were able to help me to get this opportunity. So I say thank to them. There are so many people who are having this eye and cataract problem, and I wish they could also get this chance today, but many of them couldn't get it, and I'm praying that they will also have this chance one day. It's a problem. I sometimes have it difficult reading. Anytime I want to read, especially in the night, I find it very difficult. But I believe today it will be over for me. I'm so happy.
Everyone, I am a nurse at the Amasaman Government Hospital, and then a group of doctors came here today to do some free surgeries for people, and it has been a great success because a lot of people do not get a chance to do their surgeries because they do not have money and all that, but then these doctors came in to help us, and then we are really grateful for that. So if there's anyone around or wherever you find yourself in Ghana, if you feel that you want to benefit from these surgeries, you can contact them, and then they will be willing to.
Yeah. Oh, okay. Now, so far, no treatment is saying.
Oh, we are coming. By trying, maybe. Oh, yeah, then the more say, waiting my boy me. And I, yeah, that Obibia so more or boy, my side didn't feel on because I didn't have.
For how many years?
I think 5 years. No, yeah.
Now when you start with that.
As it's kind of born and normal born, as a mean hard work continue. And Pisca, I almost say first number 2,500. The 2,000 no, my 2,000. Now, we can share me brothers in the same common one, but almost so I said, no man is Basabi Visa, to your money, Tina, I have a pa. To your catcher, me say, you be sign a misu, sign a tear there, says me banner, the said it here. So far, me buy and you be a comer.